It is a very dire situation, isn't it?
And it's been a dire situation for many years and decades now. And, you know, clinicians like myself who work as abortion providers across the country have been saying that there's a crisis for many years. And unfortunately, we're not met with the necessary leadership that we would expect for such a problem.
Who are you expecting this leadership from? Who are the people who are supposed to be leading the charge?
Yeah, you see, the Choice on Termination of Pregnancy Act was passed in 1997, and that act gave conditions to who, where, when and how termination should happen. And the National Ministry of Health is the custodian of all health laws, and they should be giving and providing services as per the Constitution, as for the sexual rights and reproductive rights. And I think the choice to choose whether or not to continue with the pregnancy remains a very crucial one for many, many women. And unfortunately, the Health Ministry fails women on many levels systematically. You know, whether you are a young person requiring contraception, whether you are a young person who then falls pregnant for whatever reason, including contraception failure. If you are a young woman who then makes a choice, you know, to want to end a pregnancy, if you actually then, you know, seek help and seek a facility that can help you, you are met with problems there. Often when you do find facilities, they are inaccessible in terms of literally physically. People have to drive and walk and take buses very far, and often the stock that you require, the medical supplies, are out of stock and never replenished. And in terms of healthcare provider training, it's lacking, and the department has not taken an active role in the last decade, at the very least, to train professionals, postgraduate and undergraduate, to make sure that they offer ethical and you know, care that's up to standard.
When you engage with the authorities, what do they say?
They don't even acknowledge your correspondence, unfortunately. And that's the situation that we find ourselves, that you find that the leadership is apathetic. They are clearly anti-choice and on record being anti-choice. And I think the way that they practice medicine is still very paternalistic and really lacks the reproductive justice lens that's required in terms of respecting people's autonomy and making sure that their health system is ready and able to assist anyone who requires any service for that matter. But you find that abortion care is often stigmatized and discriminated against. And I think in the context of South Africa and the global politics, we cannot ignore the fact that South Africa's health system and the programming that's designed and geared for women's health is funded by US aid and foreign funds, which often dictate the terms and how our health system is able to cater to women's needs. The global gag rule is now being expanded under the current US president's administration. And I think it's in the uncertainty that our health department continues to self-gag in a way. They don't support any work on advocacy that's related to abortion care. They do not support any NGOs for that matter in terms of training health providers. They remain inaccessible to all forms of communication, and unfortunately do not respect the science that medicine is in terms of using the evidence base to make sure that policy inclusive, to make sure that policy translatable into accessible care, and to making sure that if there are, for example, healthcare providers who are obstructive, who are dishonorable, who are disobedient in offering services to women, that those people, you know, there's recourse for those types of patients, and those healthcare providers, frankly, have no place in medicine if you go into place morality or theology over your patient's needs.
So it's not just a resource or training issue, there's old attitudes.
Attitude remains a big problem, and societal attitudes in general, because a lot of the stigma, a lot of women are already self-judging and self-loathing because, again, they think they're doing something wrong. There is absolutely no public health campaign that's designed to help women know what the law is, that abortion is in fact legal in South Africa, where to seek help and what to do when things go wrong. You know, the health ministry took out radio ads and print advertisements where the minister talks about every 8 minutes a woman dies of an unsafe abortion in South Africa. They can't tell you where they found those statistics, and they have no plan to remedy that situation. So unfortunately, as we've seen with Life Esidimeni, you have people who are in power, who have the authority to be able to offer services and give dignified care, and they don't do that. They fail on a systemic level continuously. And unfortunately, on this issue of abortion, the minister can't say he didn't know. He took out print and radio ads admitting to that statistic, and yet there's no, you know, there's no action, there's no plan, and there's absolutely no leadership.